My name is Debra, and I've been an educator for 39 years and retired in 2022. I had knee replacement surgery with Dr. Mark. Well, normally, it was constant pain in the knee, and I went to see Dr. Mark. This was a couple years before the surgery. He said, let's try a few things. So we tried the cortisone shots, and then we went to the gel shots. I went on vacation in October of 2022, and the pain was just, trying to walk from the airplane to the baggage claim, and it was just painful. So it was time. Working out was difficult. I love to work out, and I had to stop that because the pain was too bad. And also walking up and down steps, that was very difficult. Seaview Orthopaedics has been here for quite some time. Whenever my kids were injured and needed, surgery, that's where we went, Seaview Orthopaedics. It's right across the street from our house, so it's very convenient. Okay, so when I decided to go ahead with the surgery, I met with Dr. Mark. He said, well, we've got a couple options. There's a new knee out there called the SmartKnee. It's technologically driven, and he said, are you interested? I said, tell me what it does. So it monitors your steps, your speed, your stride, cadence, distance, and range of motion. So he would be monitoring my progress after the surgery. Also, what this does, you have a home base that you plug in at home, and you carry around your phone with you all the time. And the phone is what gathers the information and transmits it to the doctor. So it's a My Mobility app on the phone. And prior to the surgery, it provided direction. It told me what I should be doing every day, gave me exercises to do, and I really think that helped with my recovery. It went without any incident in the hospital. Brick Hospital was wonderful. They have a brand new wing for hip and knee surgeries, so it was a pleasant experience. Yeah, so physical therapy came to the house initially, and then I went to the rehab, which was right around the corner from my house, which was nice. And then once I was able to do the basics, riding a bike, walking up and down stairs, I was done. So then I started, doing more at home. I also bought a bike, an indoor bike, before the surgery because I knew I'd have to do some exercise after to help strengthen the muscles around the knee. I'm feeling great, and this is my 1-year anniversary, February 20th. Enjoying going on vacation and being able to do things that I want to do and not be in pain. Well, talk to your doctor. The doctor will exhaust all options before, suggesting surgery.